So all of the rain we've had has made the grass taller, the flowers more colorful, our bayous are filling up, but there's a lot of standing water. I know there is in my yard, and that can breed mosquitoes. Plus all of the warm, humid weather. The mosquitoes just really love that. There are precautions you can take to protect yourself from those pesky bites, and sometimes we wonder what's the best stuff. We are joined by board-certified dermatologist Dr. Ingraham with more details today. There is a moment that when you get to the store and you're looking at everything that's sitting there and you're thinking, which one's really the best? Let's talk over-the-counter stuff to begin with. What can we use and at what ages is it most appropriate for kids and for adults?
So the three main ingredients you want to look for are picaridin, DEET, and oil of lemon eucalyptus. So picaridin is a newer molecule. It's been around since 2005 or so, and it's great for children 3 years of age and older. It's a little bit easier on the skin than DEET. It's effective, and it's in a product I actually brought, which is called Cutter Advanced. They have several products in the Cutter line that have the picaridin in them. Then, of course, there's DEET, which is in most of your off products and some other brands. DEET is our tried and true product, very, very effective. It's kind of the gold standard. Children less than 6 months of age should not use anything, but older than 6 months can actually use off, and up to the age of about 10 or 12, you can use 10% DEET or less. Over 12 years of age, we can use the higher strengths of DEET. The last one, oil of lemon eucalyptus, more natural. Great product in a line called Repel, and that's actually equivalent to about a 10% DEET product. So if you want something more natural, that's a good product.
Are there truly some people who are more susceptible to bites than others?
There are some lucky folks. So about 80% of the reason we get bitten depends on our genetics. And there was one study that showed if you have blood type O, you can be more often bitten. Of course, it depends on the species of mosquito. So that was only one species tested. So depending upon the species of mosquito, some of us are more delicious than others. A lot of that depends on our body size. The larger you are, the taller, the heavier, the more lactic acid you sweat, the more carbon dioxide you emit, the more they want to bite you. So bigger is not always better.
One final note, I know a lot of people worry about the toxicity of some of the repellents, and you recommended some natural oils as well. But are you saying that perhaps, you know, it's better to go ahead and use some of those products because of the risk you put yourself at with the bites?
Right. So DEET is a very tried and true and tested product. Put it on areas where you're not covered. So put it on your legs, your arms, and then wash it off at the end of the day. We do know that mosquitoes can carry some very lethal arboreal viruses. So we want to make sure people protect themselves. Some of the kind of more natural oils you can find in some products, geranium oil, peppermint oil, they can be helpful, but they're not going to be as good as a DEET-based product or a picaridin or an oil of lemon eucalyptus product. And I do think it's more important that we avoid having our children and ourselves bitten by these mosquitoes that can carry these viruses.
Doctor, thank you so much for coming in this morning. It's advice we unfortunately all need around here.
That time of year.
All right, thank you.